Welcome to this presentation of innate immunity. I am so delighted that you've taken a few minutes out of your busy schedule to view this presentation. I'm your presenter, Celia Grossman, naturopath and clinical nutritionist of Naturopath Solutions. As many of the patients that I see in my clinic suffer from some form of inflammation, and as here in Australia, in the Southern Hemisphere, we are approaching the cold and flu season, I thought this would be a great opportunity to explain the initial responses of the immune system when it is confronted with invading disease causing microorganisms or when there is an injury. So, what are the body's first responses to either injury or infection? Innate immunity is the first response to infection and injury. It is present in your body since birth. It is not specific and therefore does not differentiate between invaders such as bacteria, viruses, or fungi. It also occurs very rapidly. How lucky are we to have such highly effective frontline barriers as the skin and the mucous membranes? The skin has many layers and the cells are closely packed and keratinized. Also, microbes on the skin surface get removed constantly as there is continual shedding of the outer layers. The skin also secretes an oily, waxy substance called sebum that has antimicrobial properties. Let's look at some other forms of the first line of defense. Some of these are very annoying, and we commonly believe they are produced by the offending microbes. Yet these are responses by our immune system, not bacteria or viruses, and are actually highly effective. So we need to be careful that in the initial stages of any cold or flu, that we hold off in rushing to the pharmacy to buy products that will artificially stop these processes. Now let's look at a few of them. The mucus lining body cavities, such as the upper respiratory tract, the gut, and the genitourinary tract, secrete mucus which traps microbes and foreign substances due to the fact that it's slightly viscous. For example, the mucus that is produced in the small intestine prevents foreign matter from entering the bloodstream. Nasal hairs and cilia, which are hair-like structures, sweep away microbes and dust from the upper respiratory tract. Coughing and sneezing also eliminate microbes before doing any damage. Therefore, when a cough starts developing, it is a good idea to postpone using any over-the-counter cough syrups, as this might make the infection worse. Of course, if the cough is not productive, interferes with quality of life, and continues for a long period, we need to address it. Saliva, tears, and blinking wash away and drain any offending microbes and foreign particles from the mouth and the eyes, as well as the presence of lysozyme in both these fluids, an enzyme that breaks down the cell walls of microbes, killing them. Urine, diarrhea, and vomiting cleanse the body by the rapid evacuation of offenders. Indeed, we often feel much better after we have vomited. Also, the acidic pH of the stomach, skin, and vagina make these areas unsavory to microbes. And of course, fever, which sets the body temperature at a value higher than that preferred by microbes, namely 37 degrees Celsius, and hence will either stop their spread, kill them, or both. But what is the first thing we actually do when we develop a fever? We take Panadol or Nurofen to bring down the temperature artificially, not allowing it to help eliminate the offending disease-causing microorganisms. Furthermore, the lower temperature fools us into thinking that we are well, causing us to resume our normal daily routine and thus not allowing valuable convalescent time. Both these outcomes can possibly be responsible for a protracted illness where we are not recovering as quickly as we should be. However, once again, if the fever is above 40 degrees Celsius, or it's going on for a while and it's not coming down, it can be dangerous and medical attention to bring the temperature down is warranted. So what happens when the first line of defense has been broken, like cuts, stings, and burns? Inflammation is the body's attempt to get rid and stop the spread of microbes, toxins, and foreign substances at the injury site and to prepare it for tissue repair. Inflammation is characterized by the symptoms of redness, heat, pain, and swelling. Unfortunately, if not dealt with effectively, inflammation can be a serious problem and results in chronic conditions. So it is highly important that the immune system not only produces inflammation as a response to injury, but also manages to stop the process when healing has occurred. This diagram shows a contaminated splinter piercing the skin. When such an injury occurs, a non-specific inflammatory response is triggered at the tissue site. Mast cells in the surrounding tissue release histamine from the histamine granules. Other chemicals are also released to the area. Histamine diffuses into our small blood vessels called capillaries, causing them to dilate and become leaky. Platelets, which are clotting factors, are then able to leave the blood and start the clotting process. As capillaries dilate, the area appears red. As plasma, which is the fluid portion of our blood, leaks into the tissue, the area swells. Pain occurs due to the nerve ending damage, swelling, and the effect of some of the chemicals released. Chemotaxis is a process that allows certain white blood cells, such as neutrophils and macrophages, to leave the blood and migrate to the damaged tissue. Neutrophils are the first to appear and are often present within an hour of inflammation starting. However, they die off quickly and then they are followed by the much larger white blood cells known as macrophages. The phagocytes continue to wage the battle. They not only digest the offending microbes, but clean up the cell debris and dead neutrophils at the site, producing pus. After a while, histamine and complement signaling should cease, and phagocytes should no longer be attracted to the area. The tissue returns to normal, and all is hopefully good. However, if our immune system is compromised due to the fact that we have nutrient deficiencies or eating an inflammatory, nutrient-poor diet, or the infection is just more aggressive and cannot be resolved, the acquired immune system takes over. This is an immune system that develops in our lifetime. It's very specific. It comprises of specific responses such as antibodies that wage war on the microbes themselves and certain chemical mediators that attack the infected cell directly. As previously stated, though, if the immune system does not mount a sufficiently robust response, or the body actually mounts an immune response to our own tissue, such as that found in autoimmune conditions, chronic disease can result. In a future presentation, I will outline how such disruptions in our immune system can occur. This is the conclusion of this presentation, and thank you so much for listening.